How does the heart get blood to itself? Well, let's build that system from the ground up so we can understand it better. So first of all, we're going to need a pump. So let's use the heart. So here's our pump, the left ventricle, and it's filled with blood. Now we're going to attach a pipe to that pump to carry blood out to the rest of the body. That's the aorta. Now we're going to place a fitting in between that pipe and that pump. That fitting is a one-way valve, and that's the aortic valve. Blood can get out of the heart into the aorta, but it can't get back in. Now we're going to drill 2 holes at the base of the aorta. Those holes are called ostia, and we're going to install 2 smaller pipes onto each one of those holes. Those pipes are the left coronary artery and the right coronary artery, and they go on to branch out into smaller and smaller and smaller pipes and envelop the heart and feed the heart. Now, here's where the action starts. During the systolic phase, our pump contracts and pushes blood out into the aorta and forces the aortic valve open. And that pushes the flaps of the aortic valve in front of those holes, in front of those ostia, making it difficult to get blood into those holes. Above that, the left ventricle contracts so hard that it pushes against the left coronary artery, and you can't get blood through there at all. Now, there is a little bit of turbulence that's created around those flaps, and we get kind of a hydraulic in front of those holes. That allows some blood to get into the right coronary artery because it's not as highly pressurized. So now our systolic phase has stopped, and we've entered the diastolic phase, where the heart is refilling. That blood creates some back pressure during this phase and pushes against the aortic valve, closing it. And so there's a lot of pressure right there at the base of the aorta. That's when that blood is forced into the right coronary artery and the left coronary artery. And to summarize, during that diastolic phase, that's the only time the left coronary artery can get blood and perfuse the heart, but the right coronary artery can be perfused during both of those times. Here's one key clinical takeaway. It is incredibly important to think about this when you're doing chest compressions, because if you don't allow full recoil, you won't allow enough blood to get into those ostia, into those coronary arteries, and you won't get enough blood to the heart, and that is the whole thing.